Hi, my name is Amy Regal, and I'm here to talk about the book The Day the Voices Stopped, a Memoir of Madness and Hope by Ken Steele with Claire Berman. In his book, Steele talks about the illness and madness caused by the onset of schizophrenia. In his book, he also talks about his road to recovery, along with his work of activism and advocacy. Born October 9, 1948, Steele was your normal average boy who loved reading. However, on one night on October 60, 1962, while listening to the radio, he began hearing voices instead of the lyrics. These voices would be low and insistent and telling him ridiculing thoughts such as, the world would be better off without you, that you're no good, and they'd also accompany with ways of committing suicide. These voices prompted him to run away from home, and he attempted suicide multiple times. After many failed attempts, he returned home and was taken to his family physician, where he learned he'd be diagnosed with schizophrenia. Schizophrenia is a severe psychological disorder with disorganization in perception, thought, and behavior. People with schizophrenia also have the inability to think logically, and they also may have cognitive and functional impairments, and also behave in a manner that prohibits normal and everyday activity and work. In order to be diagnosed with this disorder, you must have at least two positive or negative symptoms present. Positive symptoms are the added aspects that you may have, such as delusions, hallucinations, and disorganized speech. Negative symptoms are the lacking aspects, such as the lack of drive and motivation. In Steele's case, he talked about how he had auditory hallucinations, which were the constant and insistent voices that he would be hearing. And he also experienced delusions of influence, which were the manipulating thoughts that he was hearing through radio and television while watching the news and listening to music. Steele also talked about how he also became worn out and confused, and these were also common symptoms that come along with schizophrenia. At the age of 18, he moved to New York City and got a job and was able to have some sort of structured routine life. He said that he really enjoyed having a structured routine life because that kind of helped keep him under control from his voices. He lost his job about 6 months later, and this led to a downward spiral, and he ended up falling into the hands of some bad people. Due to these functional and cognitive impairments that he had due to his schizophrenia, is what made him an easy target to these violent and non-violent crimes. He was able to get out of the situation, but he sought refuge, and he attempted suicide by jumping off a building. He was found while he was trying to attempt suicide and was admitted to the Manhattan State Hospital, where he was given Thorazine, which is an antipsychotic drug that acts as a sedative and tranquilizer. He was given this antipsychotic medication to kind of help keep him calm and his symptoms at bay and keep him under control, but he was committed indefinitely to this hospital. However, due to the overcrowding that was occurring and his good behavior that he developed after maintaining a structure and orderly life at this institution, he became eligible for transfer. This transfer disrupted his structured life that he had established, and he said that this is kind of what led to a revolving door of suicide attempts and running away and going in and out of several mental institutions all across the country. However, along the way, he was able to maintain residency at a halfway house, and he was able to go out and work, and he worked in a nursing home as an order cook, and this provided some other order and structure that he needed in his life. Steele also talked about how he still loved to read and write, and that the reading kind of helped the voices go away. However, they didn't always keep the voices away, and they would get the best of him, and he would be going from mental institution to halfway house all across the country from New York to Hawaii. Some of the common things that he was treated with were typical antipsychotic medications such as the Thorazine or Haldol, but these medications can have some severe side effects such as muscle stiffness and body tremors. He talked about how he was sometimes given such high doses of these medications that he would get contractions in his eyelids and he'd be unable to open them for long periods of time. After going all across the country and in and out of different mental institutions, as a last resort, he went and visited the Park Slope Center of Mental Health back in New York City. He was visiting the therapist, and he was also able to be visited by many different physicians, and he also discovered that he had sleep apnea. And so he was giving a new medicine for his schizophrenia as well, and instead of a typical antipsychotic drug, he was given an atypical antipsychotic drug, which also helps treat the positive and negative symptoms. However, there are less side effects to accompany these. And he was given Risperdal as his antipsychotic drug. On May 3rd of 1995, the voices that he had been hearing had stopped. After his voices stopped, he was able to reunite with his family and work on various projects and jobs. And he also became an advocate for mental health until his death on October 7th of 2000. Due to the causes of schizophrenia being unknown, many researchers like to focus on just eliminating the symptoms of the disease, and so common symptoms for this are antipsychotic drugs, which is what Steele was most commonly treated with, along with psychosocial treatments and social skills therapy, and they'd also be individual and group therapy as well. Sometimes they also use electroconvulsive therapy in these situations, but usually only for the most severe cases. In research, in an 18-month period, it was reported that 60% of patients were prescribed different medications. However, just like Steele, the lack of effectiveness of some of these antipsychotic medications would be reasons why they would quit. Atypical psychotic medications usually is what helps the best, like in Steele's case, Risperdal, which allowed the voices to disappear. The prognosis of this disease is usually poor, and the term schizophrenia also kind of comes with a negative connotation. And with the history of Steele's past and multiple suicide attempts, running away from home, poor family support, because after moving away when he was 18 years old, his family really had nothing to do with him. This kind of set Steele up for a very poor prognosis, and oftentimes the result of this disease results in suicide or death by some means of that. However, he was determined and he continued working, and after recovering, or as they say, in recovery of the voices going away, he was able to find different jobs and work on different projects. He had worked on a political campaign while he was in California at a halfway house, and he really liked the work he did there, so he wanted to start an individual project after he had recovered called the Mental Illness Voter Empowerment Project. And this, he told that, being mentally ill and mentally incompetent are two different things. And so he said that, sometimes people with these illnesses don't have a say, but mental ill and mentally incompetent are two different things. So his goal with this job was to engage around 300 people. However, after 2 years of starting this project, he was able to register over 8,000 new voters with the help of 75 volunteers. When his voices stopped earlier, about a year ago, he felt compelled to tell the news to anyone and everyone he could. He was selected to participate in a panel by the American Psychiatric Associations in Boston, and he also helped with finding solutions to different problems caused by schizophrenia. He would appear eventually in the New York Times, and he also became editor of the New York City Voices, which is a newsletter that the Park Slope Center for Mental Health would release about every month. And here they included personal stories of people with mental illnesses and advice for those coping with this disease. And he'd also placed an ad in the paper about a group therapy for self-help led by him, and it was a big hit. they would have him 6 to 17 participants, and with this, Steele was gaining more and more publicity, and which also compelled him to help more people diagnosed with this disability. Steele was diagnosed with schizophrenia at a very early age. When diagnosed with schizophrenia at such an early age, it also can lead to even more severe complications. But, his multiple visits in and out of different mental institutions and halfway houses, he was able to combat the symptoms and eventually fight for his life. And for 3 decades, he put up with the voices inside his head and multiple suicide attempts, and was able to go into recovery. And since his recovery up until his death, he was voice free. He quit hearing the voices. He continued taking his medication, but his life came to an unexpected end in October of 2000 when he died of heart failure. However, he had an impact on the world of schizophrenia and mental illnesses, being an advocate for many others, and his work of activism with the different mental illnesses, because as many people would believe with his prognosis that, he wouldn't live very long after his diagnosis. But he defied the odds, became a big help to several others, and his legacy will live on. Claire Berman, which was his co-writer, said that to her, he was a hero, an American hero, especially to her, because she was able to see how strong he was, and he wouldn't let this mental illness keep him down. So, schizophrenia can be a scary thing, but with proper treatment, of medication, support from your family, therapy, as well as psychoeducation to help inform family and friends and you about the prognosis and the symptoms of this disease, it can be overcome and contained, and doesn't have to be something that could end your life.